ACM, or Ambulatory Claims Manager report tools. We're going to go through the reports that are available within ACM. If you do not currently have ACM, that is something that you can talk to our support team about, and we can get you the information on how to move forward with the Claims Manager with RelayHealth as your clearinghouse. Okay? So we are going to go in. What we're looking at right now is the Claim Manager portion of Ambulatory Claims Manager, or ACM. Within this Claim Manager, there is a report function. Now, there is a separate webinar that goes through the Claim Manager and this Task Manager icon that you see at the top of the left side. But today we're going to focus just on the reporting tools. So, over on the very right upper corner of your screen, there's a button that says Print Reports. This is one of the ways to get to these reports. Okay, this is a shorter list that kind of gives you the most common reports that are available. All right, we're going to go through each of these, but we're going to look at it from a different location. Okay, so this report button gives you all of the most popular, if you will, reports for ACM. Now, if you go into your search tools over on the left side, it's going to open up a new window. Okay, within this new window, we have a Report Manager tool up at the top. There's the Report Manager icon or button. Okay, go ahead and just choose an office here, and we're going to go into our Report Manager. Now, this Report Manager is a longer list of reports. Okay, there's different types or classifications of reports. All right, and we're going to talk about those, and we're going to go through and look at several of these. All right. Within this, up at the top, we have two search fields. One of them is a report class, and the other is a report type. Okay, so report class, the different classes of reports, and you can see down the left side of my screen, the very first column, we have claim and dashboard, ERA manager, ERA dashboard, statement, and management. The ones that you're going to see in your claim manager are going to be the claim and dashboard reports. All right, we don't have statement reports available in ACM because our statements are done with the clearinghouse in a different manner. Okay, the same thing, the ERA manager and the ERA dashboard, we're not going to get into those today either because not everyone has those ERA files coming in, and again, we're not going to have anything available within the claim manager at this point to show those EOBs, okay? However, the claim and dashboard reports, those are going to be very helpful. So this report class filter at the top just allows you to kind of sort out that particular type. You know, if you only wanted to see the claim or you only wanted to see the dashboard reports, we can look at just those, okay? The report type over here, these are the different types of reports. So you can see in the second column, we have web browser and web data miner reports, okay? We'll get more into the difference of those in a few minutes, but the report type, that's what it allows you to do, is just view the web browser or the data miner reports, okay? So not very often you'll really even use those filters, but they are there if you would like. Now, we have the report name in the third column, and then we have a description. Okay, the description is just going to give you an idea of what each of these reports do. Okay, batched claim count. Claims batched and sent for a selected date range. Now, as we go through this webinar, not all of these reports are going to give us data. This is a demo environment, so some of them, you know, this information has been in here for quite a while, so we might not get a lot, but you'll be able to at least get an idea of what the report does. Okay, and within your own claim manager, you can come out and look at these reports, view your own information. You're not going to hurt anything at all within the claim manager. Okay, they are just reports. It's just pulling numbers for you to look at. So let's kind of go through some of these. If you right-click, you have Help, Submit, and Cancel. Those will actually close the screen And if you need help on something, call our support team. Don't go in here and call RelayHealth because they will refer you back to Management Plus support. So just call or email our support team. So we're going to double click on this first one, which is the batch claim count. All right. It's going to pull your customer ID, and then you can put in a date range. We're going to go ahead and we're going to go back to 2008 because I think that's where most of our data is. And we're going to save this to generate. Okay. Let me choose a different customer. Sorry. All right, so batch count. This really is just a count of batches that we've sent, okay? It shows the transmission date, the batch name, the claim count, and the dollar amount. So this report is helpful when you want to kind of verify what RelayHealth received versus what you sent from Management Plus. You can kind of match those up. All right, so it is, as you can see, just informational. There's nothing you can do or change in here. It's just giving you the number of claims that you've sent and the total dollar amount by batch for that date range. Now, of course, you could enter a smaller date range and it wouldn't be quite as long. All right. The change log. Okay, within this change log, this is where you can go view a specific staff member and the changes that they have made. Okay, let's see if we can do this without a staff member name. It should give me everything that anyone has changed. Some of these do take a minute to pull. Okay, so this is going to show you the history of claim edits. All right, shows you the patient information, the user in your office that changed that field, the date it was changed, okay, what was changed before the edit value and then after the edit value. Okay, and it also shows you the claim status. So this is good to run if you want to just kind of see who's doing what with your claims, who's working rejections, who's making corrections, things like that. All right? As we go through these, some of these you might find more helpful than others. That's why there are so many people like different things. Okay? So let's go into this claim analysis. So with the claim analysis, this is a data miner report. Okay? The data miner report typically will, just run this, will let us configure and kind of customize this report more than the web browser. Okay, the web browser report that we just ran, the first two were just web browser. It gives you the information, you can print it or not, that's pretty much it. Now with the data miner report, you can actually create configurations. So it's similar to our custom reporting, where you choose the columns that you want to see, the order that you see them. All right? I'm going to run just the default for now. Okay. Within these data miner reports, these basically what we call columns in our custom reporting, RelayHealth calls blades. Okay. So in this first column right here, you can see the unused blades. All right, so if we wanted to sort this by billing provider, come on, okay, we can add the billing provider over here. Okay, should let me move this over. Okay. So in this first column, all of these are blades, basically columns that you want to have in your selection. Okay. By default, this is just showing us the payer, the total number of claims, and the total dollar amount that were claims that were uploaded in this date range that we specified. So the month of August, okay, these are all of the claims that were uploaded with the total dollar amount showing here. So we have 3,500 claims totaling, just over $2 million. So what we can do is choose the date or choose the additional columns that we would want to see. Okay, so if I wanted to see the patient name, I don't know why it's not letting me add these today. Okay, we want the patient name over there, and maybe you did want the billing provider. We can have that information pull into this middle section, okay? And then we could kind of filter it down and drill down to the patient level, all right? This one seems to be locked, so I cannot change it, but that's what this is for, okay? Once you've configured this the way you like to see it, then you can save that configuration by clicking the Save Configuration button in the top right corner. You'll be able to name it and then hit Save, okay? You can export this information to Excel. Okay, I know some people do like to have that information to work in Excel. It pulls right in. You can also export this to a comma delimited file and email to someone else if you needed to. All right. So this claim analysis is really just showing you the claims that, this is a summarization, claims that were sent by insurance with the dollar amount. Okay. If this was not locked, we could come over and show the actual, patient information, their date of service, referring doctors, and so on. All right? So this claim analysis is one that you would want to use on a pretty regular basis, just to keep up on how many claims you're sending for each insurance company. Okay? Now the claim error analysis is going to be a little bit different. This is where we can drill down to the level of the denials. Okay? So we're going to run this. Okay, so this is now sorting those claims, again, for the same date range. We have the month of August. This is our default configuration. This is going to show us the actual denial messages. So what are our most common denials? If you're looking in this error count column, 16 is going to jump out at you. Insurance payer ID match not found. Okay, that's something that you would want to call our support team, and we'd get that fixed because that's a significant number of claims that are rejecting for that. Okay, CAS segments. We have another one down here with 18 rejections. Paid amount and CAS segments do not equal, so we know we have some secondary claims that we need to go out and work. Okay, and it gives you the total errors for that month with a matching dollar amount. And again, we can add these columns over to our, what we want to see in the row, and view the detail of that. Find the patient information, find the date of service, right? And just so you know, this does work in the live systems because this is a demo environment. That's why I think they have them locked, okay? But again, you can save that configuration for this specific report if you wanted to. And again, you have the export options for Excel. The claim rejection analysis, this is going to let us drill down for the rejection messages. So this is going to be more of the insurance rejection, okay? Not necessarily the clearinghouse rejection. So if we look at this, all right, we can kind of move this over and see that these errors, invalid member number, claim, the claim cannot be found in the adjudication system, subscriber level errors. All right, so again, it's just sorting out and subtotaling what are your most common rejections. That could turn into a training opportunity within your office if we can identify where those errors are being made. Is it data entry for the patient demographics? Is it posting errors? Is it something that needs to be configured differently within Management Plus? All right. So again, some of these are going to be more helpful than others. The claim status activity log is just going to show you status changes. So if a claim was set from invalid to ready, all right. So on this one, we're going to see these it's a log of different status changes that have been made within this report. Okay. Some of these others we're not going to go through. I know this is taking a minute to pull up, The claim status by date is just going to give you a list of statuses. Again, was it an invalid claim? Was it a rejected claim? Is it accepted or paid, approved? Things like that. Not give you as much detail, just it's by status. All right? And this one's not giving us anything either. Okay. Claim status by payer is going to show a status summary by payer. Again, with these statuses, these are what is the status of that particular claim. Okay, so in here you can see it's broken out by insurance company. Okay, the number of claims that are accepted, number of claims that are showing as acknowledged, complete, denied, paid. All right, total claim amount. This is not going to let you drill down to get patient information of, which ones are denied or which ones are rejected. That's going to come from the rejection report itself. All right, this is really just a quick snapshot of the claims for that date range and kind of where they fall in the status categories. Okay, claim summary. The claim summary report is a summarization of claims to date by claim status. So again, it's going to look like the one we just ran, just not broken out by insurance company. Okay, clean claim report. This is going to show us all of our clean claims. Okay, so if we wanted to see, we'll do primary and professional. Okay, we can look at our clean claims. It's going to give us a little breakdown of claims that were uploaded, how many of them were clean, and how many of them have rejection. So really just a percentage of what claims are getting out in the first time and they are clean. Okay, this bottom section shows claim with initial errors, so clearinghouse errors, and then payer rejections. All right. So again, you might like it, you might not. That's okay. This is just a list of payers for claims, electronic remit, eligibility, and the claim status. We're not going to look at that one. You will have it available in your screen if you wanted to go out and look at that, though. Now, the transaction analysis, this is going to let us see and drill down to the claim level. This is, again, by rejection. Right now it's sorted by CPT code. Okay, the description of that code. This is how many times you use that code. Okay, so this is just analyzing what you've sent. All right, so we could kind of go down and see, which codes you're using most. This is going to be pretty similar to the monthly CPT count, monthly production analysis within Management Plus, just in a slightly different format. And again, we could add additional information if we wanted to make this report larger and have more drill down opportunities. Okay, the zero paid claim report. This is going to be kind of a safety net for you. If we come in here and we we'll look at July and August again, this is going to show you claims that have not been paid. All right, so again, a safety net to see for these dates of service what has not been paid. And ideally, we want this report to be blank. We don't want to see a ton of information out here because that means our claims are not getting paid. Okay, so this is a good one to run on a regular basis and keep track of what's going on. Okay, now these dashboard reports, so these were all claim related, so claim specific information. When we get into the dashboard reports, these are all web browser, which means we're just going to run them and it's going to give us whatever it gives us. These are going to be more of a, let's see what we've got in here. Let's change our client and run this. These are going to be graphs and charts to kind of help you track what's going on. So this particular one is an audit alert. Shows you, year over year, the dollar amount, and then it has your the legend up here. So the green is this year. The audit, right now we have nothing in here. We haven't worked or audited any of these claims. Not worked, but audited any of these claims. Okay. Audit alert, this is going to give us any alert, but we know there's no audit, so that the alert report is going to be blank also. However, claim aging by amount, change this to our medical center. When we look at this claim aging, it's just going to give us this little graph of your AR days, and then it has this color coding of kind of what's going on. So the blue is accepted, we have red are the errors, green are paid. We want more green and blue than anything else. And then we have the purple for processing. Okay, any other claims that fall into these colors would show that color as well. All right. So, of course, we want these higher AR ranges to be very small dollar amounts, or as far as, rejections are not paid claims. Okay. So all of these dashboards, these are just going to be they're just going to show you graphs. Okay. So this one is an aging by payer. Now, this one is a little bit different. So this is going to combine all insurances on the first tab, and then you can break it out, show just Blue Cross, just TRICARE, just commercial, okay, Medicaid, and then Medicare. So this will let you filter out those top insurance categories, and then you can, of course, view all of them together. Okay, our next one is going to be the claim status by payer, and again, this is going to be by insurance company. Let's get a valid year. We're going to run this. And again, you can see up at the top we have the tabs to break out this information. Okay, we can view just Blue Cross. We can view all payers. This is just going to give you a quick pie chart of what's going on. So again, accepted claims, we have green is paid, and then we have these error and complete claims in here, and it gives you the percentages. Okay, again, we want all blue and green, or eventually all green. Okay, again, broken out by insurance company. Okay, some of these, and you can print anything you want from this report manager. You can also just run them and call it good. It's entirely up to you. Get a valid date in here. Okay, this one is going to be the claim status categories. So this is not broken out by insurance, but again, what's accepted, what's paid, what's rejecting or completed or pended. Okay, just it's not by insurance company. I would think that by insurance company is going to be a little bit more useful to you because you want to know who's paying what and who's not paying what. All right. Now, the initial rejects and the payer rejects, these are both going to be helpful for you to run. This is going to show us the initial rejections, which again are at the clearinghouse. Payer rejections are at the insurance. So this is going to tell us the top rejections for that date range. This is a very large date range. We have valid city, state, and zip code. Insurance payer ID is not found. Valid ICD-9 code. Patient city, state, and zip must be valid. Okay, subscriber ID is an invalid format for Medicare. So this report would trigger and alert me to run another more detailed report, one of these claim reports, to find out these patients, and then take this and use it as a training opportunity internally for whoever is entering the patient addresses. Because this is, 32 claims that have patient address errors. Okay, and then another 11 for a Medicare ID number being entered incorrectly. So these are good training tools for your staff. Okay, now the payer rejects, this is going to be for the payer rejections are going to be rejections at the insurance level. So the claim passed the clearinghouse, now it's at the insurance, and it rejected for subscriber level errors or subscriber not found, coverage is canceled, invalid characters in a referring physician loop. Okay, these are different things that may not be training opportunities, but things that we need to look into and correct so that those claims can be paid. Okay, so that's the difference between initial rejects and payer rejects, just so everybody knows. The scrubber rejects, we actually do not have scrubbing turned on for any of our clients. All right, so that one will give you a blank page. The reject report is going to show us kind of all of that information we just looked at in one screen. Okay, so it captures all of it together. Here's our initial rejections. Here's our address claims that we had. Scrubber rejects, again, we don't use. Okay, we don't use the EdFX rejects. And then the payer rejections, again, here they are. So it just lets you run it in one report instead of two. Okay, top 5 rejected payers. This is going to show us our top 5 payers by rejection. Medicare of New Jersey is a big one. Aetna, Cigna, Empire Blue Cross, and Empire Blue Shield. Okay, so here are our payers who are rejecting the most. Medicare wins this one. Okay, so again, it just gets your attention. It captures that information for you and makes it easy to pull a report based on the claims that you've sent to the clearinghouse. Now, if you're printing claims on paper or you're manually entering your optical claims on their website, that information is not going to be in ACM because the claim never made it to ACM. It was not sent to the clearinghouse. So just keep that in mind when you're running these, especially when you get into these AR amounts. That is, only for claims that were loaded electronically to RelayHealth and to ACM. All right. Now, like I mentioned before, these other reports that are in here, we have the ERA managers. This is going to be based on, I know I said I wasn't going to get into these, but these are based on electronic remits. So this is showing us, this particular one is an analysis by procedure and reason. So basically, what are they adjusting off? The CPT code and the modifiers. Okay. This is pulling from any electronic remit information or any electronic remits that come into RelayHealth. Okay, they can't analyze what they don't have, so this is only going to be for electronic EOBs. Okay, it just shows you the adjustment totals and then the count for that particular information. Okay, it's here if you want it. If not, that's okay too. This one is an analysis by reason. Same information, just a slightly different format. Okay, so this actually gives us the codes first and has it subtotaled by codes, by the adjustment reason codes. All right, the denial analysis. Let's see what this. I don't know if this is going to give us anything, but we can try it. Yeah, there's nothing in here for that. So you can go in and look at those if you do have electronic remits, and you can see these in your report manager. They're not all going to be available depending on what you have. Okay, the summary graph, this is going to show us, try that again. This is going to show us a summarization just in a graph form of, again, using that ERA information. Okay, paid, expected adjustments, unexpected adjustments, pretty much all there is on that one. Okay, aged cash graph, denial rates by procedure code. Change this. Okay, so again, it's just graphing out percentage-wise the denial rate, and if you hover over it, it gives you that code, the dollar amount, and then the rate of the denial percentage. Okay, so this one, that code, not being paid. Okay, what's billed, again, by CPT code and the total amount billed. All right, so we need to, this could be helpful for you to kind of watch what codes are being paid and what's not. All right. Top 5 denial codes with amount and the volume. This is going to be, again, using the EOBs that come in, a CO18. So kind of the same information, just in a different format by adjustment, or by the adjustment reason codes. Okay, so if you know those codes, this might be helpful for you. Otherwise, we can just use the reports that actually tell us what they did. Okay, now these other reports that are down here, the provider list report, the customer billing report, these are most likely not going to be in your list, and definitely the statement reports will not be, because we do our statements a different way with the clearinghouse. RelayHealth does have other vendors and clients that use the statements this way, but we do not. All right. The manager, or with this provider list report, the management report, this we can come in and view a list of the providers that are set up for your office. Okay. The other way to get to your provider list, just so you all know, is this provider list button under Search Tools. Okay, there's a provider list. This is going to take you out to where you can see what providers you are going to be billed for. Every doctor, every name that's in here is going to have a P or an N. Okay, if it has a P, you are going to be billed for that person or that physician. All right, if you have a surgery center, it's going to be billed for that surgery center if there's a P. Now, this is something that's kind of off topic, but important nonetheless. If you should be coming in here every month between the 1st and the 4th of every month and viewing what doctors you're going to be billed for. And if there's a physician that was accidentally billed on a claim, that's how these names are populated, is by the claims you send. If there's a physician that was accidentally billed and they should not be here, you need to double click on that person's name, change it to non-person, okay? And over here on the right side is a per transaction button. That tells RelayHealth this was billed incorrectly, and this is not a new physician for us, and don't bill us, okay? So when you save that, you see now we have an N instead of a P. That's what it should be, so you do not get billed for that physician. You should only be billed for the doctors that you have physically working for your office or at your office. All right. So that is something, again, I know it's off topic, but something that everyone does need to know. If you didn't know, now you do. If you did know, great. Make sure you're going in and checking those. Okay. So coming back into the report manager, these are the reports that are available. And like I mentioned before, when you are in the claim manager looking at your claims, working your claims, you do have this print report button in the top right corner that gives you a small sampling of kind of the most common. This is what they recommend you run over the others. The others are just there if you like them, if you want to run them. Okay, there's certainly not a problem with you running those. You can't hurt anything coming in here. Okay, so go out into your ACM, go through your reports, see what's going on with your claims, with your information. Like I said, make sure you're checking your providers every month. And if you do have any questions, let us know. Get a hold of our support team. That pretty much is, and that kind of wraps up the webinar for today. I do appreciate your time. And again, if you have questions, let us know, and I hope you have a great day.